Good morning, folks. Good afternoon, good evening, depending on what time of day it is in your world. Blair Schachterly from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. So today's video blog is on 2 things that you can do at home. There's a whole bunch of different types of back pain, but there's 2 main back pains that we see in our practice on a daily basis. The first one is inflammatory back pain, and typically that happens to us in our 20s, 30s, and 40s, where we get a disc protrusion. So the bad ones are called herniations, where they go out and don't go back in. The protrusions after time will shrink back down and come off the nerve, so the sciatic pain usually goes away, or the back pain. And usually for that we're doing what we call a backwards arch. So I'm just going to demonstrate that right away. So we're going to lay down on your stomach. We're going to put kind of an ice pack right on your lower back. We're going to stretch out, okay? And then we're just going to relax like Superman. Then slowly bring your elbows up into 90 degrees elevation, okay? Let our back sag there. Now if that's really painful, that's as far as you go, okay? If that's comfortable, then what you can do as you're getting better is you can squeeze your cheeks and try to arch up even further, okay? And then down slow, and then stretch back out again, like you're Superman, okay? And you're gonna repeat that 3 times in a row, and rest for 5 minutes. 3 times in a row, rest for 5 minutes. 3 times in a row, and then rest for 5 minutes. So you end up doing 3 sets of 3 reps, about 9 in total, over about a 15-minute period. And that can be done anywhere from 3 to 6 times a day, depending on how it feels. So if it gives you relief, you can do it twice in the morning, twice in the afternoon, twice in the evening. So for my younger clients, basically I say if it's a weekend and you can't see me right away, this is something you can do at home to start to basically reduce your back pain. And that's the inflammatory back pain. Okay? The second type of back pain that we see in our practice quite commonly is more of what we call a stenosis. Well, that's where we get arthritis, where the bone actually starts to grow, and we get what we call osteophytes growing down into the nerve canal, giving us sciatic pain and sort of a pinched nerve in our back as well. And that typically happens in our 50s, 60s, 70s, 80s, and up. And essentially the best exercise for that is what we call flexion exercises. And how you would try those at home is basically laying on a heating pad for about 20 minutes to half an hour, and just kind of laying right down, getting really comfortable. Basically just relaxing, grabbing the back of your knee and pulling your knee right up towards your chest till you feel a gentle stretch in your back. Hold there for about 5 seconds, and then back down slow. And then rest for 5, and then grab the other leg, and then pull that one up as far as you can till you feel a gentle stretch in your chest. I always jokingly say, don't try to get your knees to your ears on the first day. So just be really careful of how far you pull up. You want to be nice and gentle and just create a little light stretch in your back. You don't want to increase your back pain. If you're getting increased back pain, you're pulling too hard. So just really gentle there. So you do each leg individually, and then you rest. And you do 5 repetitions. If that felt good for your back, the next level of that exercise is basically reaching and grabbing both and then pulling both up so you get a nice stretch in your back, and then down slow, okay? And again, hold for 5, rest for 5 if you can, and 5 repetitions is a good rule of thumb. And then patients will always ask me, like, how many times a day should I do this? Well, with that exercise, it's the same thing. If it feels good and you can do it kind of once in the morning, once in the afternoon, once in the evening, and you're getting relief with it, then by all means the next day I would do it twice in the morning, twice in the afternoon, kind of twice in the evening. And then definitely seek help if you can, because the sooner you get in for therapy, generally the better. But I hope that helps you guys, because that gives you 2 things you can try at home that basically should start to modulate or help your back pain. Alright, so there you go, my friends. Blair Schachterly from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Take care, and we'll see you in the clinic soon. Bye-bye.